This is a video introduction for the Creative Health Toolkit.
The Creative Health Toolkit can be found here at www.creativehealthttoolkit.org.uk. It was developed in partnership with NHS England Personalised Care Team and 4 integrated care systems: Gloucestershire, Shropshire, Telford and Wrekin, Suffolk and North East Essex, and West Yorkshire. The aim is to support other integrated care systems to understand the enablers and barriers to embedding creative health across their system. You can see that it has sections on creative health in systems, in context, and in action, and I'll explain all of these briefly. Further down on the home page, there is a definition of what we mean by creative health, which can include activities using any art form, as well as cooking and creative activities in nature, and creative health approaches, which may involve creative and innovative ways to approach health and care services, co-production, education and workforce development, for example. The NHS England Social Prescribing Maturity Framework provided us with the 5 domains in the system section: leadership and strategy and governance, planning and commissioning, workforce development, digital and technology, and evidence and impact. If we go to creative health in systems, this first section is on leadership, strategy and governance, and we have a short description of what they mean and then some actions to take. Leadership focuses on collaborative approaches and distributed leadership, including supporting leaders in the voluntary community sector. Actions to take include advocating and modelling the shift from a reliance on biomedical approaches to ones that include psychosocial approaches, supporting champions for creative health at all levels of the system, and establishing the necessary resources to shape and deliver creative health strategy. The strategy section acknowledges that systems will be at different stages in their creative health journey and recommends aligning creative health with existing key strategies and priorities such as personalised care and health inequalities, with a focus on how creative health can support population health priorities and health inclusion. And the strategy should be co-produced with all partners and people with lived experience. Governance emphasises the importance of good communications and clear roles and responsibilities, with the development of policies and processes to support all aspects of planning and delivery. Below there are illustrative examples, and if we click through to lots more illustrative examples, and then on page 2 of that, we have living a larger life, Calderdale Council. So this is an example of how a strategy, living a larger life, which set out plans to make Calderdale a leader in using arts and culture to support people's health and well-being, led then to a strategic post hosted by South West Yorkshire Partnership NHS Foundation Trust, and that has gone on to inform the West Yorkshire ICB's Joint Forward Plan, which has a large section on creative health. Going back to creative health in systems and to the next section, which is on planning and commissioning. This is divided up into understanding need, understanding and developing the marketplace, identifying resources, investment and funding, and workable commissioning. This section emphasises the importance of co-production in understanding the needs of the population and working with the cultural providers to support them to be able to meet that need with creative approaches and programmes. The actions to take encourage collaborative working, involving people with lived experience and supporting networks and knowledge exchange. Mapping the cultural assets in an area and then developing the local market is about encouraging collaboration between providers and recognising that difference and diversity are responsibilities of everyone, including commissioners. There is an emphasis on pooling resources, on community grants and joint funding bids, but also where commissioning is possible, providers can come together in consortia or alliances so they are able to articulate how their work meets health priorities, and commissioners are able to adapt and respond to the needs of those providers in terms of type and scale of contracts. So looking at the illustrative examples in this section, again, on the second page, we have workable commissioning, example of creative consortia constituted Gloucestershire Creative Health Consortium, which was supported by the commissioners so that providers could come together to form a consortium in order to deliver arts on prescription. Procurement advised a prime provider model, but the consortium are hoping to transfer to an alliance contractual model. So going back to creative health and systems, the next section is workforce development. There are sections here on skills, knowledge and education and support. In both cases, the actions to take recommend sharing practice across sectors, joint training and supporting networks of peer support, as well as providing supervision and good governance. An illustrative example on page 2 here is the Children and Young People's collaborative project in Shropshire, Telford and Wrekin, where the collaborative was intended to bring together partners who had different perspectives and specific areas of interest with young people, and that collaborative working would lead to learning from each other. The next section is digital technology, which includes digital systems and governance, and talks about opportunities to spread creative health work being identified through developing and maintaining digital directories for what's on offer, enabling digital self-referral, as well as recording data for evaluation digitally with collaboration around what data is collected and why. Much was learnt through the pandemic about how to combat digital exclusion, and creative health organisations can both support digital inclusion and provide innovative ways to engage people who aren't connected. Going on to the final section here on evidence and impact. This recommends supporting purposeful data collection to inform delivery and demonstrate impact, as well as encouraging a move from proving the effectiveness to improving practice. It also encourages accessing national evidence to inform local planning and practice, and to disseminate evaluation outputs and learning to support the spread of creative health. And in the illustrative examples, again on page 2, we have an example from Suffolk and North East Essex, and a creative health offer that was commissioned by Suffolk and North East Essex Long COVID Assessment Clinic. Quantitative and qualitative data was collected to measure impact on 5 key symptoms of long COVID, and the findings from the pilot were used to refine and extend provision for a further year. Going on to creative health in context, this covers the context of health inequalities, the wider determinants of health, self-management, health and care settings, and the life course. And what you have here is policy context, how creative health approaches, and then key areas of focus. For example, in this case, experiencing homelessness or drug and alcohol dependence. Going through to the next, which is the wider determinants of health, that covers employment, housing, and financial well-being. And then self-management includes cancer, cardiovascular disease and stroke, diabetes, chronic respiratory disease, maternity, and severe mental illness. Across the life course, that's fairly self-explanatory. And in health and care settings, we have hospitals and hospices, nursing and care homes, and specialist mental health settings. You'll see here that it says click for examples. You won't be able to see the drop-down menus if I click online, but if I go to illustrative examples at the top and then look for in context, and then go to, for instance, health inequalities, illustrative examples, they're actually bite-sized, these examples, with links through to organisations outside of the toolkit for more information. You can see at the bottom of the page here, interested in submitting an illustrative example, and we would really welcome submissions. If you click on that page, there are various options you can choose. We ask for the name of your project and which integrated care system it's in, and then there's a downloadable Word template which you can upload. Finally, Creative Health in Action is a series of checklists covering creative health development, finding the right creative delivery partner, and supporting delivery and ongoing monitoring. Within each of these, there are a number of checklists. Here, agreeing partnership roles, agreeing scope and framework, supporting referral processes, and then a series of questions which are intended to be prompts to get you thinking about how to approach the work. So I hope that the toolkit is useful to you. Any feedback, please do email us directly on info@ncch.org.uk. Thank you.